Hello, my name's Dan Holman, and I'm the head athletic trainer at Springford High School. The purpose of this video is to share with you what the profession of athletic training is and to highlight a couple of important aspects of our job. Athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, or chronic injuries and medical conditions. Athletic training is recognized by the American Medical Association, Health Resources Service Administration, and the Department of Health and Human Services as an allied healthcare profession. To achieve certification as an athletic trainer, you must graduate from an accredited master's degree program and pass the Board of Certification examination. In Pennsylvania, athletic trainers must be licensed by either the State Board of Medicine or the State Board of Osteopathic Medicine. At Springford, we work under the direction of our team physicians, Dr. John Aylward and Dr. Adam Crush. In addition to working with our team physicians, we work collaboratively with other healthcare stakeholders like the school nurses, our strength and conditioning coach, as well as local physician groups and physical therapy providers. The Springford School District employs 4 certified athletic trainers who provide services to student athletes in grades 7 and 12. Here to talk about concussions is Max Coulter.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head that can change the way your brain normally works. Concussions can also occur from a blow to the body that causes the head to move rapidly back and forth. Even a ding, getting your bell rung, or what seems to be a mild bump or blow to the head can be serious. Concussions can occur in any sport or recreation activity. So all coaches, parents, and athletes need to learn concussion signs and symptoms and what to do if a concussion occurs. More detailed information on concussions is found in your registration packet as well as on the Springford Athletics website. In Pennsylvania school-based athletics, concussion treatment is legislated by the Safety and Youth Sports Act. Any athlete who is suspected of having a concussion will be removed from play or practice immediately and not be permitted to return to sports that same day. Any athlete who sustains a concussion will not be permitted to return to sports until they have a written medical release with no limitations from the athlete's physician. Additionally, any athlete who has sustained a concussion must follow a stepwise return to play progression. The athlete should be symptom-free before beginning this progression. The athlete should complete each level and progress to the next if they remain asymptomatic both at rest and with provocative exercise.
Thanks, Max. Going hand in hand with concussions is our impact testing process. Here is Kate Daniels with important information about our impact baseline and post-injury testing.
At Springford, we utilize the Impact Concussion software program. Immediate post-concussion assessment and cognitive testing is an objective tool used to support trained healthcare providers in making sound return to activity decisions following concussions. It is a computerized test that measures memory, attention span, visual and verbal problem solving. Athletic trainers at Springford perform pre-season baseline and post-concussion testing to aid in the management of head injuries. Baseline tests are valid for 2 years. Impact testing is available to all student athletes in grades 7, 9, and 11, along with those that have never completed the test. This non-invasive exam takes about 20 minutes. The program is set up as a video game type format. It tracks neurocognitive information such as memory, reaction time, brain processing speed, and concentration. Impact testing is available to be taken at home, although some teams choose to take their test together as a group at school. If a concussion is suspected, the athlete may be required to retake the test. Both the baseline and post-injury test data will then be provided to your athlete to be reviewed by the treating physician. The test data will enable the provider to determine when return to play is appropriate and safe for the injured athlete. If an injury of this nature occurs to your child, you will be promptly contacted with details and further instructions. It is important to know that results from cognitive assessment tests be used as one component of the clinical evaluation. Testing results are not intended to provide a diagnosis or decision about the test taker and should be interpreted only by qualified healthcare professionals. Important information about impact and concussion is available at www.impacttest.com.
Thank you, Kate. And finally, Ryan Casper is going to explain our injury management protocol.
Thanks, Dan. Springford athletic trainers will evaluate all injuries and determine the course of action based on his or her findings. The decision for return to participation following an injury or illness is solely the medical staff, which includes the team physician, athletic trainer, an athlete's physician. This decision will be based on learned injury management principles. The primary concern of the injury management protocol is the health and well-being of the athletes. Athletes will not be rushed back prematurely and risk additional injury. When an athlete sustains an injury, the parent or guardian will be notified by either a phone call or a note home, depending on the severity of the injury. In some cases, we will advise you of the need for your child to be seen by a physician. When an athlete returns from seeing a physician, a letter or other written correspondence must accompany the athlete answering the following questions. Is the athlete allowed to participate? If yes, what restrictions, and most importantly, when is the athlete allowed to participate? This applies to all the students who see a physician, whether or not they're referred by the athletic trainer.
Thanks, Ryan, and thank you for watching. If you have any questions, please feel free to access this information on our website or contact us at our email addresses.